A study by the Children's Defense Fund says that Minnesota is the 5th best state in the country for kids. But a closer look at the study reveals some troubling trends. While 15% of all Minnesota kids live in poverty, the numbers are much higher for children of color. 46% of African American kids, 38% of American Indian kids, and 30% of Latino kids in Minnesota live in poverty. Stephanie Hogenson from the Children's Defense Fund is one of the authors of the study, and she is joining us now to talk about this. Thank you so much for coming on.
Thank you.
All right, let's look at those figures again for how many children of color live in poverty compared to children who are white. How big a gap is this when compared to other states?
Well, other states see higher rates of poverty for children of color as well, but for Asian children and American Indian children, we are number 6 in having the worst poverty rate, so 6 being a bad thing. So right. Most other states have lower rates of child poverty for those populations, and we're right around the middle of the pack for African American children, with nearly half of our African American children living in poverty. But most states do better than us with child poverty for African American, and there are about half of states.
How about the comparison between white kids and children of color in terms of the actual gap? How does that compare to other states?
It's right around the same. We have about 9% of white children living in poverty in our state compared to those higher rates for children of color.
You know, one of the most surprising figures in this entire study, I thought, was that we rank 6th. We're the 6th best in education for kids. So you think that's great, that's fabulous. However, 59% of Minnesota's 4th graders are not proficient in reading, and 53% of 8th graders are not proficient in math. How can we be 6th best?
Well, that just means other states are doing even worse than that, which is a frightening thought. And there's a lot of things that we can do to improve reading and math scores and other educational outcomes. And really those things are starting to be done, and we've seen improvement since 2005, which the study compares the current year to. And so we need to invest in high quality early education, because we know that when children have a healthy start and a start where they can learn early on in life, they're more likely to succeed right away in kindergarten and continue to succeed later on.
You know, another thing that I thought was interesting about this study is that here in Minnesota and across the nation, the rate of teen pregnancy is actually down dramatically. We don't hear about it as much. It's still a problem. Tell me about that.
Right, it's been falling since the beginning of the 2000s. The teen pregnancy rate has in Minnesota and across the country, and so we think that we're talking more about it, we're addressing it with teenagers, and we're improving access to sex education as well as methods of prevention. And so we hope that continues, because we know children born to teen mothers often are more at risk to live in poverty and have poor health and education outcomes.
Right, and we're actually doing a lot better than the rest of the nation in that category.
We are, correct, and we started out at a better rate too, and we declined. And there's many states, you know, California, Texas, that have higher rates of teen pregnancy that are also seeing dramatic declines.
All right, so this is an annual study that's actually been done sort of nationally in conjunction with the foundation going back a couple of decades. So obviously a lot of data here that you can really look at.
There is, and it's, you know, it's a lot of different indicators that you may not think are related. How are educational outcomes related to teen pregnancy? How is poverty related to health indicators? But really we see many children of the same children represented in each of these poor outcomes, because we know poverty is related to educational outcomes and health outcomes and higher rates of teen pregnancy. So,
all right, well, Stephanie Hogenson, thank you so much from the Children's Defense Fund. We certainly appreciate it.
Thank you.
All right.